They say, as you know, Mayor, that poor folks who don't have the access, the cachet that a Rudy Giuliani does, wouldn't be able to get the treatment you did under this system and would die.
Well, actually, that's not correct. The poorest people in America are covered. They have Medicaid, Medicare. The reality is that the people who don't have health insurance in this country are not the poorest. They are people who are consumers. But we're not making health care affordable enough for them. These are people who buy other things. They may buy televisions, they may buy cars, they may buy cell phones. They're consumers. But the health insurance is either too expensive or they don't see the value of it. So how do you solve a problem like that? Do you solve the problem like that with a socialist model, a centralized government, or do you solve it with a big consumer market? Of course you solve it in America with a big consumer market. So what we need are more people in that market buying their own health insurance. It will drive down the price. And in the same way that you make retail goods and high-tech goods available to poorer people by driving down the price, that's the way you're going to make health care available. And in that way, you preserve the essential private nature of it. If 50 million Americans were buying their own health insurance instead of just 17 million Americans, I guarantee you the price would go down by 50, 60, 70%, and believe it or not, the quality would go up. Because that's what happens as you have a bigger and bigger consumer market.